So welcome everyone. I appreciate you joining into the webinar. We wanted to essentially send out a couple of emails to sort of update everyone on where we're at. One of the things we like to do is sort of stay on the cutting edge, which means we always are sort of rolling out a lot of new products. So we're going to talk a little bit about some of our most recent product rollouts today. That's really what it's going to be about. And then hopefully we're going to follow up with a recorded version of this webinar, and then we'll follow up again with some of the newer forms, such as our newer updated price list and updated product information. My name is Ryan Smith. I think most of you all have had a conversation with me in the past. But I just wanted to obviously welcome you all. At the end of this conversation, Blake McLeod, also one of our pharmacists, will be talking about some new products as well. So I appreciate you all joining in, and we'll get right to it. So first and foremost, we also want to just let everyone know about our online order portal. For most of you, you're probably already familiar with this, but I do want to just let everyone know that it exists. You can find it on our homepage, and that there are some significant advantages of doing this. A lot of the documents which you've typically, sort of had requests from us for are on here. So any of the new peptide sheets, any of the new information which we'll follow up on the email with, will be on this website. So if you were to log in, your login screen looks a lot like what's on the screen right now. It's going to have the ability to write a new prescription, to check the status of a current prescription, or to edit your account information with new billing, with new shipping, with anything, any changes that might have happened to your account. And so this is sort of what you will see. Beyond that, this is sort of what it looks like for your prescribing page. So you can choose any, to bill a patient, bill a clinic, and all of your patient information and clinic information is stored, so you don't have to continuously write it every time. And again, if you're already prescribing via an EMR system which already does this, then we obviously completely understand, but it still has some good functionality in the reporting. So if you look at the page that's on right now, obviously you'll be able to track invoices, track shipments, and actually track where it is in our pharmacy. Beyond that, you can also see the tracking number for each product as well. We're obviously, this is a little bit new for us, so we're sort of polishing and perfecting a lot of things. Whenever you register, you also choose the ability to get notifications at certain stages. So if you're using this, you can have the ability for your patients to get notified via text or email with the moment we receive it and the moment we ship it. So some really cool functionality which will be constantly improving on that website. And then again, as an incentive to order through there, we're giving a 5% off any order placed online. So it might be an interest to some of you, although probably not as interesting as some of our newer products. So we'll get right to it. Most of you all are familiar with our tesofensine, which we've had for quite a while. I'm going to go over it just because of the combination we're now doing, which are some of our newer products. So the tesofensine is a really, really cool drug, probably most synonymous to your other anti-appetite drugs like phentermine. The cool thing about this one is it's not a controlled, although it is a dopamine reuptake inhibitor similar to phentermine, it also has a serotonin and noradrenaline reuptake component. And because of that, it was originally studied for its ability to treat Alzheimer's and Parkinson's. They actually started the trial, and then they had to quickly end it after they found their patients were losing a little bit of too much weight. The cool thing about this is we're the only compounding pharmacy to have a supply of this. We're really the only people, other than the Danish biotech company, to actually even have a global supply of this, so we're pretty proud of it. But again, sort of going into its history, it sort of had to be discontinued relatively quickly because of the weight loss effects. And so since then, it's been, I guess, repurposed for just particularly its weight loss effect. So they just finished their phase 2B clinical trials in late 2017 and are already sort of pursuing it, hopefully for FDA new drug application approval in early 2019. So the really cool thing about this is, even compared to phentermine, your weight loss as a standalone product is pretty significant. We usually say around 25 pounds over the course of 6 months. And although that is dose dependent, which I'll talk about a little bit later. So this is sort of the results of the phase 2B clinical trial. The phase 3 clinical trial results are also so far very, very positive. Again, this is dosed as an oral capsule, which is, again, unlike a lot of the other products we sell, which are peptides, this is not a peptide. This is a small molecule, and we recommend sort of that middle dose. Obviously, you have dose-dependent results, but the difference between the 500 microgram dose and the 1 milligram dose is, in terms of results, is relatively small, whereas the contraindications, or I should say the adverse events, go up significantly. So for this, we definitely recommend the 500 microgram dose because it sort of sits in the perfect spot in terms of best results for fewest amount of side effects. And the side effects you're gonna see are gonna be listed here. Mainly what we see is dry mouth. Sometimes you get some GI side effects. I would say that's very, very rare. One of the ones that we've sort of seen anecdotally that's not listed here is sort of some anxiety-provoking effects, just like you would have with any type of stimulant, even similar to too much caffeine, which can happen from patient to patient. The other thing we've sort of documented on here is the increase in blood pressure. That 2 to 4 millimeter of mercury was an increase in blood pressure at the 1 milligram dose. So we typically don't see that nearly as much with the smaller dose, the 500 microgram dose. We also know that, for most of the people you're treating for weight loss-related concerns, a lot of times blood pressure or high blood pressure is included with that. And again, we don't see a ton of difference anecdotally, even though that's reported at the highest concentration. And lastly, just because, again, this is still in clinical trials, we do not recommend it with any other type of psychiatric drug or reuptake inhibitors, such as, your SNRIs or your SSRIs. And we sort of say that's a complete contraindication just to be safe. So overall, this is, again, an appetite suppressant drug, which has been very, very effective for us. We've been pretty happy with it, and I think most of our patients and most of our physicians have been happy with it. But we've even gotten a little bit better as we've added some other products to it, which I'll go into. The other thing to note about this is that this patient population was done, I guess for these studies, was done in an obese patient population. So if you have a lot of patients who are a little bit leaner, have a little bit less weight to lose, then you're not going to see probably that 25 pounds that they saw on the study. So definitely something to be aware of. And for those people who are just joining in now, if you're a little bit late to the conversation, don't worry. We're going to be sending out this recorded webinar, and we'll send out the slides as well so you all can have it. So that's the tesofensine, which again we've been doing for a little while, not quite 6 months yet, but it's definitely one of our newer drugs. The one thing we want to talk about are the drugs we use with it. And so the amlexinox is one of the drugs we definitely use with it. And the amlexinox is actually an FDA-approved product, which is traditionally an anti-inflammatory used to help heal ulcers. And so it actually, was an FDA-approved product for quite some time, and then it essentially stopped being produced as a manufactured product just because there were better products on the market. Fortunately, there was sort of, a revival and for its effect in type 2 diabetes. So because the tesofensine works on appetite suppression, we like to look at the other side of it, which is increasing metabolic rate. So if we can reduce caloric intake and increase metabolic rate, we see some pretty good results in terms of fat loss and weight loss. And so this is what we do. We like to combine the tesofensine with the amlexinox and the product I'll be talking about shortly, the tetradecyl thioacetic acid. So this picture actually comes directly from the study that I think is probably the most promising, talking about how it affected inflammation and metabolic state in people who were, diagnosed with type 2 diabetes or progressing on the level to type 2 diabetes and high insulin resistance. And so, again, we're just trying to increase insulin sensitivity, and then in addition to that, we see a thermogenic component expression in fat. So we basically see the fat like to burn itself. And again, it's working via the NF-kappa beta sensitive gene. So it downregulates the TBK1 and the IKBKE. So for those of you who are not familiar with those, I'm not an expert of those at all, but they're nuclear transcription factors, which play, again, a role in the insulin resistance. So by inhibiting those, and again, I've included an excerpt of a study here, which shows that the mice who have genetically been predisposed to these types of mutations where they're not expressing these are much, much less likely to develop insulin resistance, and they're much, much less likely to put on weight. So we're essentially using exogenous dosing of these molecules, particularly amlexinox, to, again, silence the transcription factors which might be implicated in type 2 diabetes. So again, the baseline versus the amlexinox treatment over time. Traditionally, we like to do sort of 2 months on and take some time off, and that puts us, right around a little bit under the 12 weeks, but we definitely see improved metabolic state. We see better insulin sensitivity. We see weight loss. We see, a lot of reduction of inflammatory mediators like C-reactive protein. And so, and it additionally sedimentation rate. So we see a lot of really, really good changes in that time. And the 2 weeks on, 2 weeks off is just as much for the amlexinox as it is for the tesofensine. We don't want to significantly disrupt neurotransmitter levels, and we don't want to significantly, change its metabolic state. We like the sort of on-off approach because you don't develop any tachyphylaxis, and it stays as a very, very effective protocol. And so again, going through here, the amlexinox trial results were really good. In 12 weeks, HbA1c levels were significantly reduced. One of the other important things to note is that it doesn't affect all subjects equally. As this diagram above shows, you definitely have some who respond and some who don't respond. And generally, the baseline levels are going to be the same, but you'll notice a change very, very quickly. And then, which is very, very interesting. In terms of segmenting that, we really don't have very many diagnostic criteria. So we don't know how to identify patients who will be responders and who won't be responders. But then again, we saw higher energy expenditure associated in responders, which again is burning, essentially burning more fat, increasing the metabolic rate. So we like to pair those two together, but we like to actually compare, and again, the dosage for that is going to be, again, an oral capsule. It's 40 milligrams, and we take it 3 times daily. In the trials that have been done with this, there haven't been any contraindications, and the only side effects that have been documented have been just a rash. And again, if that ever happens with your patient, we've never seen it, but if it does happen with your patient, we sort of recommend to discontinue the drug. And so the last part of that is we actually compound that in the same capsule as the tetradecyl thioacetic acid. So many of you who are probably familiar with performance enhancement or some of those other, fat loss drugs that have been popular are probably familiar with the PPAR, the peroxisome proliferation activated receptors, which help with beta oxidation. And so that has been classically been a target. It's been a target of some of those black market drugs like the GW1516 that have been studied for over 10 years. And so this one is the one that we feel very, very comfortable with. And we pair it to cause, again, to sort of activate the PPAR delta receptor in particular, which increases, again, the beta oxidation of fatty acids. So it reduces, lipids in your bloodstream, which obviously helps with metabolic rate, but it also has the sort of side effect of helping with endurance. So people who take this might feel, an increased energy and be able to, again, continue exercise a little bit longer as well. So we combine that actually in the same capsule as the amlexinox. So we recommend that as 300 milligrams per capsule combined with the 40 milligrams of the amlexinox. And again, we recommend that timing to be the exact same, so morning, afternoon, night, 3 times a day. In terms of contraindications, again, this is actually a supplement type product, and it's actually got really good phase 1 clinical trials in terms of safety and efficacy. And so I've sort of copied and pasted below here some of the side effects you can experience, but overall, the combination of this product along with the tesofensine has been very, very popular for us. And with 2 months on, 2 months on, we see really, really good effects. And we see effects not only on, body fat composition in terms of if you're doing a DEXA scan or if you're doing an in-body, but we also see better response on blood levels with your HbA1c levels, and then some of those inflammation levels as well. So that is by far gaining a lot of momentum in terms of our new products. And from here, what I'm going to do is turn it over to Blake. Blake will talk a little bit more about some of the other products, particularly the Jhk Copper, and sort of how we've changed in our recommended of dosing. And then also one of our newer products, which will roll into a hair protocol probably in a month with some really, really exciting new products which we haven't talked about yet. And so we'll roll out a hair protocol toward the end of the month, which will be found, again, on the back end of that website. So feel free to register there. And with that being said, I'll turn it over to Blake.
Hi, thanks again for joining me. But like Ryan said, so the Jhk Copper, many of you all may be pretty familiar with, since we've been using it for the last couple months. But it is one of our newer products. So Jhk Copper, it's a naturally occurring copper complex. It was first identified in the human plasma. But since then, it's been found in multiple locations throughout the body, specifically, saliva and urine. But it has a variety of roles, so it can be used for a multitude of different reasons and multitude of different conditions. Some of the most common ones that we use it for is, promotion of wound healing. It's a great antioxidant and anti-inflammatory effects. It stimulates the collagen synthesis in the skin fibroblasts, promoting blood vessel growth and hair follicle stimulation. That's where, the most common use is for hair loss, as well as improving, skin elasticity, and then the wound healing as well. So, and like many other things in our body, unfortunately, the concentration of that Jhk copper in the body, it does decrease with age. So it is a great product to supplement, especially as we age, for the skin elasticity, those wrinkles that none of us enjoy. So as I said, the hair loss is one of our most common uses that we use it for. So again, it has that hair follicle stimulation for the hair growth. It also stimulates the proliferation of those dermal fibroblasts, and then elevates the production of VEGF. So that's where I talked about where it increases that angiogenesis. So the elevation of the production of the VEGF is going to promote that hair growth and also the follicle size, giving it a more fuller look by improving that vascularity around the hair follicle. Another good thing about this when it comes to hair loss is it doesn't really have a rebound effect like you see a lot of times with, some other common products like Rogaine or finasteride. So whenever you do stop this product, it's not going to lead to, that rebound effect leading to excessive hair loss after stopping it. So that is one big difference from the Rogaine and the finasteride that we do like about this product. But it is one that you have to continuously, take for the hair loss. You are kind of fighting that losing battle, unfortunately. But we have seen some really good effects. And this, we use it as a topical foam most commonly. So it's a foam that you can just rub on the scalp to the area that is needed just once daily. Typically, it's used at night before bed, and then you can wash it out the next morning. So the other most common effect is that skin elasticity. So that's where, like I talked about earlier, with the wrinkles and trying to get that skin tightness. Specifically, most people use it, around the facial areas. So it stimulates that collagen and the glycosaminoglycan synthesis in those skin fibroblasts, and it also has an activation effect on some of the stem cells. So this has also been used with PRP injections and microneedling, around on the face, and use it for those wrinkles. So again, you can use this in injection form or the topical foam as well. And it does not actually have to be at the site. So right where the wrinkles are. It is used systemically, so you don't have to use it at the site of at the site that you're trying to fix. So the last one that is most commonly used for it really has great wound healing effects. So it attracts those immune cells, such as those macrophages and mast cells. As I mentioned, the promotion of those blood vessels, so that angiogenesis, getting the blood to those injured tissues to help promoting that growth quicker. The antioxidant and anti-inflammatory effects, and then that just has great wound contraction and epithelialization. So all the things that you need to help increase those wound healing. And so this is another product, like I said, we're trying in different forms. So currently we have it in the foam and injection, but we're also looking at including it with some of our other wound healing products in like a cream form. So specifically, like BPC and AOD, using those in combination as a cream all together have been shown to have some really, really cool effects on the wound healing and the wrinkling.
And for those of you who do any type of CO2, laser resurfacing, any aesthetics in your clinic, the VPC has been directly studied in CO2 laser wound healing, and it shows to reduce the recovery time in half. So doing that with the Jhk Copper, we've gotten some really, really good results with.
Yeah, absolutely. So this is one of the things that Ryan mentioned that we have changed up a little bit based on some of the research and studies that have came out is the dosing. So the dosing that we're going with is the 1 to 2 milligrams, whereas we were doing, I believe it was around 100 to 200 micrograms in the injections. We're changing that up a little bit and going to the 1 to 2 milligrams daily. So we've changed our concentration as well on the vials for the injection from the 1 milligram per milliliter to a 10 milligram per milliliter. So that way you're still doing the small dosing of the 0.1 to 0.2 milliliters daily. So typically we usually, specifically the injection, doing one round of that for a 30-day supply. And then really, you really only need to do it for maybe twice a year, so really doing 2 courses. So it is a pretty potent product, so really only 2 courses in the course of a year is really most people all they need. So again, method of administration, like I said, we have sub-Q, we also have topical foam, and we are looking into other methods of administration as well, specifically topically like creams and in combinations with other products. So side effects, the monitoring, for copper toxicity, it's one you should obviously be aware of, but one that you shouldn't be too concerned with, because it does, so the Jhk, that complex, it does hold on to the copper so it doesn't get oxidized in the body, basically until it's needed. So it kind of holds on to that extra copper until it's needed and directed to what part of the body that it's needed in. So that kind of helps prevent that oxidized form of copper, which is where you get those toxicity side effects. But some things to look for with copper toxicity is the luna of the nail, will turn blue. So obviously if you see those kind of effects, obviously hold back and kind of stop the medication and give it a month or so to return to normal. But again, it does correct over about a 4 to 6 weeks period. So that was the Jhk Copper, and so this is the new one that Ryan was talking about specifically for hair loss that we're really excited to start here soon, and it will be also included in our hair loss protocol hopefully towards the end of the month. So that is zinc thymulin. So zinc thymulin is a combination of zinc and the nonapeptide thymulin, which, like I said, is used for hair loss. Zinc, obviously, we know is an essential element, and that's the serum zinc deficiency is one of the main causes of hair loss. The thymulin's activity on the hair follicle was recently published in an in vitro study where several thymic peptides, and it showed that thymulin could extend the anagen phase of the hair follicle, which is the active growing phase of the hair follicle, which I will talk about, on the next slide. So one thing with thymulin is serum thymulin concentrations are critically dependent on the presence of zinc, which brings us to, this combination of the zinc thymulin getting the great effects that we're looking for. So the anagen phase is one thing that zinc thymulin is known to, like I said, extend. And for some of you if you aren't familiar with the anagen phase in the hair follicles and the hair growth, it's the active growth phase of the hair follicles during which that root of the hair is dividing rapidly, adding to that hair shaft. So the scalp hair typically stays in this active phase of growth for about 3 to 5 years before it goes into that catagen phase, and it becomes, detached from that blood supply, and you lose that hair follicle. So by using the zinc thymulin, you're extending that anagen phase, providing longer time for that hair to grow and grow in size, and like I said, have that fuller, thicker hair look. And again, at that end of that anagen phase, an unknown signal causes that follicle to go into catagen phase, and break off from that blood supply, which ultimately kills that hair follicle. So the dosing on that one that I'll talk about, it's going to be in a topical solution similar to the foam that we have with the Jhk Copper. So it's going to be a 2% solution that you only have to apply again once daily. So again, very similar to the Jhk Copper that you're going to apply just to the areas that are needed to have that hair growth. It's not something that you have to use as like a shampoo and put all over over the entire scalp. Just where the hair growth is needed once daily. And again, hopefully by the end of this month, we'll be able to add this to some really exciting products that we have coming for the hair loss protocol. And
we'll be actually unveiling 2 new products probably within the next 2 to 3 weeks as well. One of these is we sort of alluded to just because 2 of these products we just talked about today talk about hair growth. So we're actually going to roll out a hair growth protocol, which we've seen amazing results with, particularly for those of you who do any type of microneedling. There's a really, really exciting peptide coming out called PTD-DMB. I won't go over it too much, just sort of a teaser, but it plays a really, really good role in addition to the microneedling. So it actually has been studied to be more effective with microneedling. So we're going to sort of suggest that with the thymosin beta and then the zinc thymulin and the GHK, we've got a really good combination. We're going to throw in some topical valproic acid in there as well. But a really, really good protocol coming out there. And then we're also going to sort of talk about another product which we've been referencing for a while called the dihexa for restorative capabilities. We've been working out sort of how to dose it versus an oral versus a topical or a transdermal. I think we finally have found a way to make it safe and reliable. So we'll be rolling those out in addition to one more in the next month, and we are excited to do so. So we appreciate you all tuning in, and if you all have any questions, feel free to email me or Blake. My email is rs@tailormadecompounding.com, and Blake's is just going to be blake@tailormadecompounding.com. So if you have any questions, please let us know. Like I said, we'll be sending out this PowerPoint as well as a recording of this webinar. So if you missed any part of it, you can always look there. So thanks so much, and we look forward to continuing to work with everyone. All right, bye-bye.